Let's talk about 3 causes of low sperm count that supplements are not gonna fix. And number 1, of course, is genetics. There are a few different genetic conditions that you literally can't do anything about, you can't control. It's just a part of you that we have to consider when we're seeing low anything from a sperm parameter perspective. Something like Klinefelter syndrome, Fragile X syndrome, cystic fibrosis gene mutations, and some other chromosomal translocations all have the possibility to reduce your body's ability to make sperm. And a big thing that any sort of genetic condition or genetic anomaly does is it can negatively impact your body's reproductive organs through development. So oftentimes with a lot of genetic conditions, we'll see delayed puberty or testicular dysfunction or small testicles, but sometimes there's no signs at all, which is why whenever we have infertility, male infertility, doing some genetic testing, it just makes good sense, honestly, to rule some of this stuff out. The one big one in particular, Klinefelter syndrome, 3% of men who've been diagnosed with infertility do have Klinefelter syndrome. So not a huge amount, but it's definitely there. 1 in 1,000 men worldwide are diagnosed. It's just an extra X chromosome. And you might not have any other symptoms, right? Usually smaller testicles, infertility, it might not even be identified until you are older and start to show some other symptoms. There's some bone density pieces that can come into play. And it might be diagnosed earlier if you are delayed puberty, but I have had some clients who haven't been diagnosed until they've struggled to get pregnant, and they have been diagnosed with male factor infertility. So genetics is just one thing we have to think about that we can't out supplement, obviously, but when we're talking about figuring out why is my sperm count low, or we can insert motility or morphology. Why are those numbers low and how do I fix them? We need to figure out the root cause. And if the root cause is genetics, that's going to be a completely different treatment, AKA I would probably recommend IVF. In this case, we're not wasting time, right? We're not wasting hope. We're not wasting money on all these other quick fixes or even research methods to try to help, because the root cause is not something that supplements are going to be able to fix. So the first one is genetics. We need to have that in the back of our minds.